Hello everyone, my name is Precious Mercy, the operations manager here at Jefrat Health Hub, the #1 leading safety and health provider here in Uganda. Hey, so why are we here? I have a lovely lady here with me. Let her first introduce herself, then I'll let you know. Please.
Hi everyone and greetings. It's good to be at Jefrat Health Hub.
You're welcome.
Thank you for the work that you're doing.
Thank you.
Yeah, my name is Dr. Eleanor Nachintu and I'm a specialist, gynecologist, obstetrician, and I'm the medical director for Midland Healthcare, which is located in Kawempe, and a very good partner for Jefrat Health Hub because I believe in what you do.
Thank you so much. Yeah. Thank you so much, Dr. Eleanor. So in some of the services that we've been doing here at Jefrat, you know, we do supply of fire extinguishers, first aid trainings, and in these trainings, we extend the services unto the communities. While we've been doing these services, questions have started to arise in the communities. But one of those things that has stood out is maternal emergencies. Ladies and gentlemen, the reason as to why we have Dr. Eleanor on set is to answer maternal emergencies. And to answer these questions, we have an expert here with us and our partner. She's going to answer a few questions, and as she does, we're going to learn a lot. I too am going to learn a lot. So thank you so much for coming, Dr. Eleanor.
Glad for
Yes. So some of these questions, one of the questions that I got from the ladies, one of the ladies asked, what is a maternal? Okay, for you, you're going to tell us what a maternal emergency is. Yes. But one of the ladies asked, actually, her husband wanted to know, how do I prepare for it when it has happened? Okay, some of these questions. Let's start with that one.
Okay.
Yes.
Thank you. Those are very important aspects that come out, especially in the space that Jefrat operates.
Yes.
When you're dealing with first aid and you're dealing with emergencies, most of the times maternal emergencies are forgotten.
Yes.
Probably because we may not be able to understand them, but the most important thing is that some of them are not seen. They are not visible.
That's true.
When we talk about first aid and emergencies, people think, okay, someone has collapsed, but women are unique. A pregnant woman is unique because when we talk about maternal emergencies, it's not always something that you're going to see. And that is how we miss them out. So this is an event that is going to happen. It will be sudden. It will not have communicated before. It will cause the woman who is pregnant up to, I would say, yes, data shows maybe 6 weeks. But from experience, it can even take 1 year after delivery. You can still have a maternal emergency. So an event is going to happen to a woman during this period of pregnancy, childbirth, after delivery, that is going to cause her to have a life-threatening issues, okay? It could be bleeding, it could be collapsing. So we take that as a maternal emergency. But don't forget what I said, that some are seen and some are not seen. They are all dangerous, and we all have to know them, and we have to anticipate and expect and diagnose them at the right time to save the life of the mother and the baby.
So this husband who wants to prepare for them has to keep in mind that they could be visible signs, some could not be visible. Okay, thank you so much. Then there is a question. One lady wanted to know, with her family, they lost a mother. How does it happen? Why does a mother die during delivery?
Okay, so let me first take you back to our husband.
Yes.
I like it when men are involved because we cannot run away from family dynamics. No, when you leave a woman, pregnancy is a journey that someone needs support. So when men come out, especially the one who came out and asked that question, I really wish to thank them, but also to understand that the most important thing is support.
Yes.
Preparation. Financial preparation for your partner is very important. Though in as much as she may be working, but you as a man, you must have some money because emergencies happen.
Yes.
Then also supporting her during antenatal.
Yes.
It's very critical that you understand the schedule. that she has to go for antenatal, so that you can support her. True. So that you don't maybe plan to go maybe to visit her friend on the day of her antenatal. Yes, these things happen. And then when you go with her, it's good to understand the danger signs. You sit in the sessions with her. And in most of the facilities that we have, when you go with a man, they give you they give you like a front seat. Yes. Because we understand the dynamics. Yeah. They have to go back and work, even in as much as women work. But during that time, we expect that they are supporting. Okay? Then in decision making, decisions have to be made together. We've lost friends, even health workers. Wow. Who are waiting for their men. And I don't understand why these men travel when we're pregnant, time of delivery. That is when he remembers to go to Nakasongola and spend days. And then the woman is here, she has had an emergency at home. She's bleeding, or she has 3 previous scars, she's having abdominal pain, time to make a decision to deliver the baby preterm, but he's not there. And then the person is waiting. I have to wait for him. I have to call him. Maybe the phone is off. So when you support the woman in decision making, we save the life of the mother, we save the life of the baby. Okay? And then also in birth preparedness. Where is my wife going to deliver from? I know. That decision can be taken together. Okay? And who is going to be there? What time? That third trimester is good. Is the transport ready? Do I have is the driver there? Do I have a nearby taxi person or a motorbike person who can help me transfer my wife? So there are critical decisions that a husband or a spouse can help when we are getting ready. The other question you asked is why women die. Yes. There is no way we can discuss why women die without going through the 3 delays. Okay. This is what we call the 3 delays model that World Health Organization came up with. Why women die, especially in sub-Saharan Africa. Okay. They help us understand the dynamics in our culture and to help us navigate them. And they tackle different aspects of the health system. So delays at home, that's number 1. Delay in the community. Now, take for instance, a woman, she has not attended antenatal. She doesn't even know that bleeding, there's some little blood that is coming. She'll say, Zolubuto, ndulwalirako. She doesn't know that that's a danger sign. Yeah. Or she doesn't know that abdominal pain alone is a danger sign. She has not attended antenatal. So when the abdominal pain comes, maybe the husband will also go to Gende Tugule magnesium, and yet we are dealing with a hypertensive crisis. She has severe headache, then she just takes maybe Panadol, and yet we are dealing with preeclampsia. And those are critical signs in pregnancy. So there is a delay at home, at the community level, because maybe they don't know, they have not attended antenatal. So that is number 1 delay. So the woman may die. She can just collapse at home and die. Delay number 2.
Now, Dr. Eleanor, before you go any further,